Hello, gorgeous, and welcome to the Midlife Re-Alignment. I'm your host, Esther Blum, and I'm here to disrupt the narrative on perimenopause and menopause with humor, nutrition, hormones, and fierce self-advocacy. Together, we'll rewrite your story and the rules because there's a light at the end of the vaginal tunnel. Let's go. Today on the Midlife Re-Alignment podcast, we are joined by Dr. Anat Sapan, a board-certified OB-GYN and member of the Institute of Bioidentical Medicine, dedicated to women's health and empowerment. She earned her undergraduate degree at the University of Michigan, her medical degree from Ross University, and completed her residency at Baylor University, bringing a depth of expertise and compassion to her practice. With a passion for empowering women to take control of their health, Dr. Sapan leverages telehealth to make menopause treatment and bioidentical hormone therapy more accessible and convenient. She frequently delivers lectures and talks on hormone health, inspiring women to advocate for their wellness and make informed health choices. And I think you are going to love today's discussion on progesterone. You are one of my favorite go-tos for hormone learning and advice. And so today I really want to crack open the conversation around progesterone during perimenopause, menopause, and progesterone intolerance. Because whenever I post information on progesterone on Instagram, those posts go viral every time. It's a struggle, it's a frustration, and women need more solutions. So I wanted to kick off the discussion with you really taking us through the progression of changes of progesterone production through perimenopause and menopause and the implications of those changes.
Okay, well, let's talk about, first of all, progesterone is one of the most important hormones that there are. And I think that it doesn't get enough airspace. Everyone talks about testosterone. That's like the latest hit. Before that, they were talking about estradiol and forgetting about estriol. So we can talk about estriol another time. But progesterone is one of the key hormones that is very prominent in the body. We've got like hundreds, thousands of times more progesterone in our body than we do estrogen. And it's one of the hormones that decreases in the second half of the cycle. And when it decreases, many women will start to feel the disappearance of progesterone, let's say, because it's the decline or the rapid change, and can experience PMDD, can experience anxiety. We see it a lot in women who have autism or ADHD. They're very sensitive to the decline of progesterone. We see progesterone is the first hormone to really start declining in the late 30s and onwards. And so it's not unusual that we start seeing symptoms of the depletion, which can show up as anxiety, can show up as sleeplessness, can show up just as changes in behavior or mood changes at first. But infertility is also related to the decline of progesterone often. And so many reviewers, if they've ever tried IVF or had difficulty in getting pregnant, many times will be supported in the early part with progesterone supplementation. And
Yes.
so it's such a key hormone, and we need to talk about it.
Talk for a little bit. One thing you and I have never addressed is using progesterone and how women with autism or ADHD are more sensitive and sometimes have more adverse reactions to progesterone. Can you just take a minute to unpack that?
Sure. So first of all, I want to talk about that there's a difference between progesterone and progestins. And progestin is, so let me go back. And progesterone is the name that's used both for the category of this hormone as well for natural occurring progesterone that naturally occurs in the body. And progestins are like the synthetic version that's available in IUDs and birth control pills and progesterone-only birth control, those are progestins, those are synthetic, and they don't behave the same way. They're chemically altered to resemble progesterone, but we can't, because you cannot patent something that's naturally occurring by the body. They're chemically altered, so they can be patented. And those behave very differently than progesterone. But unfortunately, they're just, the word progesterone is just used interchangeably, and then it's also used to describe bioidentical progesterone. So you need to like have the distinction. And many women, when they're started on either an IUD or on the synthetic version of progesterone, can have side effects such as depression or more anxiety, sleeplessness. So that could happen. But when we talk about progesterone intolerance, sometimes what happens is we'll see women that we start on progesterone and they start having a sensitivity. They can have a rash, or they can have respiratory issues like a cough or a nasal drip, or symptoms such as that. And so they are intolerant, but for some women, it's a dose dependent. There's an inverse relationship. Just like some women can have a relation, an inverse paradoxical reaction to histamines, to like antihistamines. There are some people, including myself, if I take a Benadryl, for example, rather than become sleepy, I become hyper, right? So that's a paradoxical reaction where you expect one reaction, but you have a different reaction. And so we can see that also with progesterone, especially at lower doses. So it doesn't mean that you can't take it. It just might mean that we need to like push you to the higher limit of it, where your receptors have more to work with. But sometimes women can have this reaction because they're not clearing the progesterone properly, or their liver might not be functioning properly. So there's different reasons, and you need to go through it with the patients and tell them like it's not a reason to like say that you can't do it. It just might mean that we need to work together in seeing what's going on besides just giving you the progesterone.
Well, and I see a lot of women, and the most amount of comments I get on my Instagram posts are women who feel suicidal. They feel groggy. They feel depressed. They can't stop crying, extreme breast tenderness. So, those, and of course, it's really hard, if not impossible, to push through when you start taking it and you get those symptoms. And some women do better inserting it vaginally or rectally. But then my concern for those women is it doesn't address the insomnia issues that they're struggling with, because we do need, from what I have learned, we need to take bioidentical progesterone orally to make allopregnanolone in the liver and shuttle that to GABA production, which is that very calming neurotransmitter to help us sleep. So what do we do when women are having severe mood changes, and what do we do when they're having insomnia and it's not as effective, vaginally or rectally?
Well, that's not the case necessarily, because it really depends, right? The conversion to allopregnanolone will occur also at the skin, but what happens is it occurs more rapidly at the skin level, and that's why when we check metabolites, you don't see the levels. So, Dr. Phyllis Bronson and Carol Peterson talk about the conversion at a skin level, and that happens if you're doing it, if you're doing administering it rectally or vaginally or on the skin. I like topical progesterone that goes on the skin, and sometimes you do need to use oral progesterone um, in some women, and I find that oral progesterone helps more in women for who cannot do topical but need for sleep. So that's a different issue. There's a lot of misinformation by online saying that progesterone is too big of a molecule and doesn't get absorbed to the skin, and that's wrong, because when you look at progesterone and estrogen, they're very similar in size. So that's just a misnomer. It's more a reflection of the metabolites that are measured, the way the body processes it.
There is, I guess I would say, let's kind of create like a strategy, an if then strategy of routes, because most women are going to start with oral permetrium, which is bioidentical, FDA approved, insurance covered progesterone. So let's say they start the permetrium and they're feeling instantly suicidal or severely groggy. And this is at the early dose of 100 milligrams. Kind of what, obviously everybody's different, but can you kind of give a progressive treatment chain of possible scenarios and troubleshoot, how you can help women strategize on making their way through when they're trying to combat, these crime scene periods or PMDD or, really, or insomnia?
So it really depends on dose and it depends on the individual. And what I've done is I've taken patients and given them lower doses and seen like, is it that it's too much of a dose, or is it that we need to start
Mm-hmm.
lower, or do we need to push higher? And it depends on the symptoms that they're having and if they're taking it orally or placing it rectally. The problem with prometrium is that it's only available in the 100, 200 dose. So you can't really pick that up. But with compounding pharmacies, you can get lower doses and higher doses. So that's one of the things that I would try. I would try it rectally as well. The other thing is that, is it a metabolites? Like, is it that you're not clearing the metabolites? And should you be trying
Mm-hmm.
DIM or an antihistamine at the same time? To see if it really is a
Mm-hmm.
reflection of what they're feeling. The
Mm-hmm.
symptoms.
And so, what antihistamines, natural or other, do you recommend if a woman is having, these wicked side effects, and what would be the side effects that would be indicated to bring in an
So
antihistamine?
it really depends on like what they're having. Is it just agitation? Are they feeling anxious? If they're having bronchospasm, I probably would not have them just willy-nilly try this at home, and be advised by a doctor on how to like increase, because you wouldn't want to like have worsening of symptoms unedited, un unmonitored, I guess. There are some women that can benefit from having progesterone added slowly, like with skin testing even, with their
Mm-hmm.
doctor in the office. I have not had to do that with anyone, so I don't have experience with that, but I've read about that,
Mm-hmm.
but I've never seen that myself.
Are there natural antihistamines you use, like turmeric or ginger,
I
or
actually have
any
patients do
natural remedies?
something that I use in mast cell also, which is called dehist, which has quercetin in
Mm-hmm.
it, quercetin, and a bunch of other great things. I think it's a great product
Yeah.
to try.
Yeah, I love Hista Ease by Designs
Yeah.
for Health too. That's got nettles and quercetin, and that really gets people off their Allegra or their Benadryl or whatever antihistamines they're taking long
Yeah, I
term.
find that that's a great product that's out there. But again, something I
Yeah,
don't think people should just try it at home by themselves.
correct, correct. So you use topical progesterone a lot in your practice. What are the benefits and what are the potential downsides to using topical versus oral, and do you get the same benefits?
So it really depends on the patient. I love topical progesterone because it's so immediate, the conversion, and it avoids the liver. And like I'll use it at night and fall asleep within a half an hour. What I like about
Mm-hmm.
the formulation that I use, it's an organic, 100% organic jojoba oil. So it's very clean. And because it's an oil, I can easily dose the amount and increase because it's
Mm-hmm.
a liquid and then apply it topically. Um, I find that in some patients, if you need so much, right, there's just so much oil you're going to put on your body. It gets to a point where if it's so much, it's it's kind of messy. It can get messy, right? And some people don't like it.
Yeah.
So then I switch people to oral. And with the oral,
Mm-hmm.
I find that some people with the conversion, some people, maybe like 10-20% of women don't tolerate the allopregnanolone so much. It just really causes a lot of drowsy.
Yeah.
And they just don't tolerate it. So they do better with topical. Um, some women
Mm-hmm.
need the oral because it helps them sleep better. So it really depends on the
Mm-hmm.
individual, what symptoms they have.
What about, my only concern with the topical is that I haven't seen, again, more research needs to be done, but it's really hard to find any research that shows that it protects the uterus the way oral does, or even a progestin only IUD, which I used to cringe at, but it does protect the uterus. So what do you say about that?
I,
Like, how do you get physiologic doses that are going to protect the
I
uterus?
know that I would say that it doesn't protect the uterus. I just there haven't been studies that are out there to look at it. The number of like whether it's 50 milligrams or 100 or 200 milligrams, that people come up with are based on data that's largely done on synthetic progestins, right, and some progesterones. And
Mm,
so there haven't been studies to do that. I mean, people have been using topical progesterone for a long time, like 20 plus years. There's been hundreds of thousands of women that have been using this. And so looking at empirical data on how those physicians have reported, Dr. Rosensweet, who's my guru and mentor, has
hmm
had tested women's endometrial lining for a long time and then had to stop because he was putting women under exams that didn't have medical justification just to check to see the thickness. And so basically,
mm,
there's no number out there, but I wouldn't say that it does not offer protection. Again, the problem that we
hmm
see with the topical is the metabolites that are tested for are out of the blood so quickly because it goes to the skin, right? So it's
hmm
like more of a biodynamics, like how do we evaluate that? And I have not seen studies on that. Dr. Rose is
mm,
doing some blood studies on his own to like look at it. I haven't seen
okay.
anything reported.
So let's say someone is using topical progesterone in a base of jojoba oil. How are you measuring, um, you know, the levels in their bodies? How can they test and make sure that they're kind of in the
Well,
right
I go based
range?
on symptoms when someone is in perimenopause. I go based on symptoms. And
Mm-hmm.
then when someone's in menopause and they're in a adequate good symptom relief, once a year I do a 24-hour urine to look at the metabolism and I look at
Okay.
that level. But I go based on symptoms and I go based on ranges for a 20 to 29-year-old. So it's not at a range for their specific age, but at a younger age where the levels are
Yeah.
robust.
Yeah. And when you're getting a 24-hour urine collection, it's obviously progesterone's going to peak at within a few hours of application and then come down again. So,
Yeah.
correct?
Yeah.
That's what
And
it
that's
would
why I
look
don't do the
like.
Dutch test because that's like specific times, right? You're doing it several times a day. In a
Yeah.
24-hour urine, you're looking at all the data for a 24-hour period.
Mhm.
So,
Mhm. So with okay, so some of my clients and myself included, I need a sustained release progesterone, right? I blow through prometrium pretty quickly. It helps me fall asleep, but doesn't help me stay asleep. So, what do you tell those women who fall asleep with topical testosterone? Topical progesterone, but aren't staying asleep? Do they then reapply it in the middle of the night? Like,
well,
what?
there's
How do
different
they?
factors that can cause women to wake up in the middle of the night. I would say
Yeah.
progesterone is just part of it. When you think about hormones, I like to think of hormones as like an orchestra. And if the violinist plays too loud, then everyone's like out of whack, right? Or if the drummer decides to jump louder, right? So there's other hormones like estrogen is responsible also sometimes for the thermostat control at 3 o'clock in the morning. Uh, did you have a glass of wine before dinner and now you're waking up because of the sugar spike? There's so many factors that can affect sleep besides progesterone. Progesterone helps increase our GABA, our glutamate, and that like helps us relax and fall asleep. But estrogen
Mm,
plays a big role in melatonin production and how our glucose is metabolized. So that's something to look at.
mhm,
So I would say if someone's waking up in the middle of the night, do they need estrogen? Is their estrogen levels high enough? Is it too high?
mhm.
Sometimes too much estrogen can cause you to have um, temperature changes, right? So it works together. Testosterone also is helpful in sleep. So that's something there. Are they
Yeah.
waking up because their magnesium levels are low? So there's so many other factors to look at, just
Yeah.
not just progesterone. When I see some women that have anxiety, for example, and
Mhm.
I've used doses as high as 900, 1200 milligrams of progesterone a day for those women, and that seems to be very calming for them. And to me, I personally take anything above 75 milligrams orally. I can't get up in the morning, so I'm very sensitive to it.
Mm,
But these women are doing really well with high doses because it carries on throughout the day, and they need that GABA. And so it really
yeah.
depends on the individual. And I think that's what's we're finding with hormones, that it's not, it's not like going to a regular shoe store where everything is, a size 7 or a size 7, 8, 9 shoe. You might need wide, you might need narrow.
Hmm.
So it's everything, everyone's unique. You gotta look at them.
Totally. Yeah, and and women are constantly, fighting with their providers to get them to go higher dose, because I have learned from you like that you can really go high dose safely. There's very little to no side effect as if you tolerate it, right? There's no detrimental effects. You're not going to wreck the lining of your uterus or, decrease your bone density or lose cognitive function. But how can women really push their providers and say, I really I still want to try higher doses because A, it quells my anxiety, and B, it helps me sleep.
Well, that's a question that we need to address the medical community. How do we these hormone education and hormone awareness?
Yeah.
And
Yeah.
um, sadly, that's a bigger issue than I can solve. But I think with having medical personnel be aware, not only in the gynecologist's office, but in every discipline, be aware of hormones, be aware of the role that hormones play. You know,
Yeah.
I heard someone say, like, if you have cataract and you go to your gynecologist and say, I can't see, and they know to send you to the eye doctor and say, maybe you have
Yeah.
cataracts, right? Why is it that you go to an eye doctor and say, I have dry eye? They don't say, oh, maybe you're in perimenopause, menopause, or, I'm having GI issues, and you go see your internist, and they're not saying, like, oh, maybe your microbiome is altered because of your change in hormone levels. And so I think that awareness on a global level for all medical providers about the importance of hormones is super important. I think it's important for us not only to think about hormones, but also to think about receptor status. How are our receptors working? And it's really something that's not talked about. Receptor function is something that can, like, be the reason why the progesterone is not working, or the
Hmm.
estrogen's not working, or the testosterone's not working, right? Because your receptors need other things to function. It's not only the lock and key that you put the hormone in
Hmm.
the receptor and that it works. It needs nutrients like zinc, it needs magnesium, iodine, all these little things that we never even think about, like selenium. I never thought about selenium. Now I think of selenium
Yeah.
a lot because it's a key nutrient that's important for the receptors to function, but also these things are important for our liver to function. And if our liver is not
Hmm.
getting rid of um, endocrine disrupting chemicals, which essentially are things that could be blocking the receptors or blocking the receptor function, how do we get those out? And so it's looking at overall
Hmm.
health, I think, is, and that's something that you do so
Hmm.
well. I've seen some of your patients come to me and you address the liver function. And I think that's something that's so important because,
Yeah, 100%. And a lot of women, a good 30%, ironically, in the absence of hormones, are developing this non alcoholic fatty liver, which really gums up the works and makes it hard when women do go on hormones. They're not in the ideal place to really detox hormones, so they can feel worse. So it is important that you support liver function
it's,
before, during, hormone treatment. Make sure your detox pathways are aligned. Taurine, glutathione, those are also really great detoxifiers of hormones and shuttle them down the right pathway in the liver.
yeah, but the other thing
I
is
want to say,
exposure, right? Like, what are we exposed to? What are we eating? What are we drinking?
yeah,
And
a lot, all the time.
yeah, no, but it's also
Everything.
like plastics, right? Those are endocrine disruptors.
Yeah.
BPA has been known to be BPA, which is a plastic. And remember, like, years ago, they took BPA out of plastics that we were eating and drinking and renamed them as something else. But those used to be used as cow feed because they knew that they had estrogenic effects of plumping the cows up.
Mm.
So,
Mm-hmm.
we've known
Mm-hmm.
about this for years,
Yeah.
and we're exposed to it in the fabrics that we wear. We're exposed to it in where are
Yeah.
we drinking? How are we heating up food? Are we using plastic in the microwave? Those are all things that we're ingesting. We're putting on our skin.
Yeah.
And now they're tempering our liver, which I like to think of the liver as like a laundry room. If if you don't have enough detergent or water or electricity, you can't get your laundry done, right? It's the same thing. If you don't have the nutrients in, or if you're like overloading the laundry room with a whole bunch of laundry, you've just come back from a camping trip and you're eating all this plastic and things, your laundry room is overburdened. Like, you got to think what's coming in, what's it going out.
When you go to the doctor for your midlife checkup, it's hard to know where to start. That's why I created my free resource, Top Hormone Tests Every Perimenopausal Woman Needs to Know. This is an incredible resource for you to download and use to get the best medical care possible and do a deep dive on what's happening in your body. Grab your free copy at estherblum.com. There's really simple things you can do to reduce your exposure to plastics. It doesn't have to be dramatic. It can be very simple. Just instead of drinking from plastic and storing your food in plastic, changing to glass or metal. Metal drinking water bottles, glass cookware, or Pyrex cookware, glass storage containers. Using products that are very clean. Like I even switched our dishwasher pods had still a plastic lining around them. I switched them to pods that are just clean powders. I believe I used the Blue Land brand, and same with our laundry detergent. Like they used to have a plastic wrap around them, and then I switched to Blue Land tablets. Again, I have no financial ties to any of these. I'm just telling you what I use in my home. And again, our skincare, our clothing, switching to organic, clean products, using more cotton than the synthetics. I'm still guilty. I do like my compression yoga wear. It makes my ass look like 10 times better than it does. But I'm not sitting in it all day. As soon as I'm done with my workout, I get out and I go in the shower and wash off. So, just some really simple things that you can do can make a huge difference in your exposure. And even like, your meats are usually wrapped in plastic. I rinse everything off and just dry it with a paper towel. At least I may not be reducing all the exposure, but I'm reducing a lot of the exposure. So little things can help. I don't know if you want to
Oh
add to
no,
that,
I think
things that
it's
I've
great.
missed.
I have no financial incentive, but one of my favorite new products that I've been using for the last like 4 months is something called Force of Nature.
Oh, I love Force of
Isn't that
Nature.
amazing? It's
Oh,
like cut down the amount of money on cleaning products that I've had to use. You basically take salt and add it to water, and it creates it hydrolyzes somehow and creates this cleaning product that you could use throughout your house. You can even like drink it. It's great. Not to
ah,
drink. I mean, I don't think it's great to drink. You can't technically ingest it. I think using products like you said, cotton socks that are made out of wool, because on the soles of your feet and soles of your palms and genital areas is highly absorptive. So avoiding those things. I'm going to give a plug to a dear friend of mine wrote an excellent book called "To Die For," DYE. It came out a few years
mm,
ago, and it talks about dyes in the clothing industry, and that really opened my eyes to like, what are we wearing? What are we putting on our body?
yeah,
And look at the chemicals that we're
yes,
putting on. I put all my hormones on transdermally. Well, what else am I exposed to? What am I wearing? What
yes.
and I think that's super important. So it's what's coming into our body, how are we getting things out of our body, and then equalizing the hormones. I think that's the way to have great health. And then I was somewhere recently and someone said, well, you're medicalizing menopause. It's natural. And it's not like, I'm like, okay, well, how are we medicalizing it? We're living longer than ever. We've been exposed to these things that are having us age faster, right? And now we're seeing that we're aging faster because I'm seeing more women have perimenopausal symptoms earlier through the things that we just
Yeah.
talked about, exposure. So wanting to live your best, healthiest life to me is not medicalizing, it's optimizing. And how can we have optimal health? I think that's really the objective.
100%. If you had Hashimoto's, you would take thyroid medication. If you had diabetes, you would take insulin. So, and hormones, what people don't realize is that they've been taking very high amounts of hormones in birth control pills or synthetic IUDs, and replacing your hormones is about a fifth of the dose of a birth control pill or a synthetic IUD. It's just trace amounts to offset plaquing on the arteries, to offset insulin resistance, to offset bone loss, and loss of brain tissue. So it's really just a dabble, do ya? You don't have to do these super high, supra physiologic doses to get the results. So it's, yeah, a lot of people I know, they always say you're fear mongering. I'm like, I'm educating and empowering you. You can make whatever choice feels aligned with you and your body. But you should have the knowledge and know, like, hey, if you have osteoporosis or you have a history of dementia, and you have the ability to potentially offset it, like, what's the harm in it? And, there are so many good options available
So
now.
many good options. And there's an excellent book. Have you read Bioidentical Hormones 101 by Jeffrey Dash? DAC.
You have spoken to me about it. I haven't read it yet, I
Oh,
admit.
it's one of my favorite books. It's more like a textbook. So warning, it's large and deep, but
Yeah, didn't you say it was like 800 pages or
it was
something?
800 pages. It's definitely over, it's about this thick. So, in the book, he shows how progesterone, testosterone, estriol, or breast cancer protective, but also how progesterone aids in how on the alpha receptor, how where estradiol functions, how progesterone is
Mhm.
it helps regulate that function. So these hormones all work together, and it's like super important to like not vilify hormones, but basically to understand how they work, use them in the right doses because at high doses you have symptoms of excess, and symptoms of excess are not only, you know, breast tenderness, but they can show up as hot flashes, they can show up as mood changes, they could show up in many, many ways. So we have to know the symptoms of too little and the symptoms of too much
Yeah.
and how to get someone in the middle. And so when people talk about side effects essentially are symptoms that you have when you have too little or too much. You want to get the
Mhm.
Goldilocks um, space.
Yeah, and brain fog too is another big symptom when you start hormones. If your brain fog gets worse, then, under ideal circumstances, it gets better, not worse. So if it's getting worse, then you can say, oh, maybe I need to pull back a little bit. But, circling back to what you said earlier, or not, you know, it's not breast cancer. It's the number one killer of women. It's heart disease. And what really offsets heart disease are hormones, estrogen in particular, but also progesterone and testosterone. Again, help improve the vascular condition of our blood vessels, help prevent laying down of plaque, help normalize cholesterol and blood pressure. And so it's really astounding how it's so overlooked or so feared by women. And some women's cholesterol, now, cholesterol and hormones are an interesting thing I would love for you to weigh in on because a lot of my clients, I'd say about 70% their cholesterol decreases on hormones, but about 30% their cholesterol does increase on hormones. Can you weigh in on that from your perspective?
So the cholesterol is an ingredient that goes on to make hormones. And so as we enter a phase in our life, and this happens for men as well, as our ovaries and their testes stop functioning as well, the body doesn't get the memo that the factory is closing down. It just wants more. And so in many people that will show up as a production of higher cholesterol. Cholesterol itself is could be a topic of discussion for, another time. But cholesterol is very complicated topic because cholesterol, just like progesterone, gets mislabeled, right? So it's like a broad term for LDL, HDL, and triglycerides, they all get combined in there. So you have to look at like really what are you talking about when cholesterol levels are elevated. If someone has an elevated HDL, which is a good cholesterol, as we call it, right? That could be what's pushing the cholesterol number up. So you really need to be able to like look at the number, look at the various numbers and like really dissect that out. So I think that we're in a phase now where we can't just say, oh my God, your cholesterol is elevated. We need to look at what's causing the elevation in that cholesterol number, which particle and what is it. But hormones are important in how our liver metabolizes cholesterol and how we get it out of the body. And so again, it goes to show how the body is so complex. If we're
Mhm.
constipated, for example, we can be reabsorbing some of these particulars and then elevating cholesterol. That way, if the liver is not functioning properly, it's not getting rid of the LDL, the bad cholesterol. So these things are all work together, and the hormones, estrogen,
Mhm.
helps in the way the liver is processing it. So it's important. It's so complicated, you know. It's not as easy as going to the mechanic and saying, "I need an oil change." You need to learn about like what's going on there. And luckily for people, they don't need to become their own mechanics. There are people who actually understand hormones and can do it for them. You know,
That's right. That's right. And that's why you really need a partner in all of this. And yeah, I mean, cholesterol historically used to be 200 plus our age. It has so many protective benefits. You know, when I worked in cardiology units and people had heart attacks, their cholesterol would drop. We would see such a huge drop in their labs compared to their baseline. Why is this? Because cholesterol rushes to the site of injury to protect and heal the heart tissue. So it does protect our nerves and nervous system. And it, you know, our liver is also, and our ovaries are really going to talk about producing more cholesterol in late stage perimenopause to try and eke out more hormones, which our bodies need to protect our whole nervous system and our brain and our libidos as well. Too low of a cholesterol can be linked to low libido. So it is the Goldilocks method
right.
of treatment is, you know, do we need to rush on a statin? Not necessarily. We really do need to kind of let our bodies adjust to hormones and level out and support the liver. And you know, time will tell. I always say give it 6 months for your body to just kind of recalibrate on this new cocktail before you go on a statin.
I'm gonna say a plug for progesterone and the role that it plays in the nervous system, and it basically plays a role in the myelin sheath, which is the rubber that's around the wire, around our nervous system. There's a sheath, and progesterone plays a role in that. And so, patients with MS, for example, or Parkinson, have been shown to benefit from progesterone, or patients that have some neuropathies, which is nerve pain. I've seen patients
Yep.
where they apply topical progesterone and their pain can start to like ease. So it's temporary, but it helps.
Yeah.
So progesterone is so important. Also for
Yeah.
immune function. And I remember in COVID they were giving some progesterone to COVID patients in the ICU and they got released earlier. So yeah, it's amazing
Wow.
what progesterone could do. Um,
I used to rub it into my son's calf. He had this really chronic, annoying running injury in his calf, and I would rub progesterone in to help relax. He did a lot of trigger point therapy as well and chiropractic, but the progesterone and some topical magnesium, and that would help relax that one spot. I was like, don't worry, you're not going to start watching, you know, Hallmark movies and cry all the time.
Yeah, it's really interesting
uh,
because also with progesterone, people blame progesterone for, they say that they gained weight with progesterone, but what I've seen is at high enough doses, it acts as a diuretic as well. And some patients will tell me
mm,
that decreases their sugar cravings when they're on the right doses.
oh,
So
interesting.
it's just interesting to see how everyone responds differently to hormones.
Yes. And regarding, there's two more things I want to touch on before we wrap up. One is the breast tenderness and the breast enlargement, because progesterone definitely, when you're starting, it can give you a lot of breast tenderness. And if this is the case, Fiber is a girl's best friend, right? Fiber, flaxseed, chia, fruits and veggies, cruciferous vegetables, those can help shuttle hormones down better pathways in the liver and be excreted through the gut. But also don't be afraid, again, to visit nutrients like taurine and glutathione, and even like a cruciferous concentrate can be very beneficial at pushing the progesterone through. This is what I found with my own clients. What have you found with
Well, what I
yours?
find with mine is that they
Supports.
typically have, if a woman comes in and says, I have breast tenderness before my period, it's the decline of progesterone that's causing their breast
Mm-hmm.
tenderness. And I have them apply progesterone to the breast directly. And most of the time, their um, symptoms will go away. The other thing that I find is that most people, and I'm going to say like above 90% of the population, is deficient in iodine. And the breast is a
Mm-hmm.
glandular tissue, just like the pancreas, the thyroid, and then the prostate. And so adding iodine, even topical iodine, to the breast in the form of 2% Lugol solution, like adding it directly to the breast, what I found in some women will decrease their breast tenderness and also
Mm-hmm.
have decrease in density of the breast. So I've seen women with dense breasts that will apply topical
Mm,
progesterone after 2, 3 months, their breasts start to get softer. And it's the decline
interesting.
in, there's interesting, Dr. What's his name? Bronstein out of Michigan said that
Mm-hmm.
iodine deficiencies and the lack of iodine with glands the glandular tissue like swells because it's not functioning properly. And so when you add the iodine, those don't swell as much, which is what happens with goiters when you have severe iodine deficiency and the thyroid glands swell. So I like to think about that as maybe the breast swelling is similar. Like,
Mm-hmm. So do women have these like brown breasts from all the iodine, or is it just like a couple of drops and
so
some
you,
diluted in water? How did women
Um,
apply it?
I would apply it, putting it on the hand and like putting like 10 drops on and putting it on the breast, and then your hand gets
Okay.
dyed brown and then your breast, but then you wear like a black t-shirt and about 45 minutes later it goes away.
Okay.
But one of my patients came up with a way of getting a glass roller on Amazon and putting it on and rolling it on that way and said that it was less messy. My patients are really geniuses with the solutions that they come up with.
I know,
Right? They
right?
come up with the best stuff. But you can also take
Yeah,
iodine orally in the form of iodoral. Um, and that's one of the ways to do it. You want to be careful with iodine because you don't want to go
yeah,
over
yeah,
15 milligrams, which is a lot more than the RDA. I personally take 12.5 milligrams a day, but if you
yeah.
take too much, it could cause a detox reaction because you're pushing the chloride, bromide, and fluoride out of your body, and that which is something you want to be doing to like get the levels of the iodine up. But if too much, you can have symptoms, and you know, so
I
not
agree.
not do this willy-nilly
Yeah.
on your own.
Yeah, very slowly and gently, and ideally with a
Yeah,
provider.
but
Ideally with a provider. Don't necessarily self-treat with iodine.
fine.
Just yeah. So let's close the loop on this amazing discussion. And where should women start when they are really not clear on how? Well, let me try one more time. All right. So all of this has been so awesome. And I really just want to close the loop on this whole progesterone discussion with a couple of final takeaways that you can give to women when they're on the hormone bus and struggling a little bit, particularly with progesterone?
Okay, hold on. I'm gonna give you an answer in a second. Okay, we paused it, and now I'm gonna say. I think that just don't give up is the number one thing. Is don't give up. There's different modes of getting progesterone. You need to be patient, see what your symptoms are, and gradually increase. Not be scared of doing the paradoxical increase because of the symptoms that can occur when it's too low are very different than the symptoms that can occur when you're giving higher doses. So take that into account. Don't be scared about going up in doses as long as you're not having like bronchospasm, obviously respiratory things, and doing it on your own, I think that's the biggest thing, is to realize that you want to like log your symptoms, see what you have, make sure that you're working with bioidentical progesterone and not synthetics. We can show up at greater sensitivity. And if you need a derm person to do skin testing on you, that's something to think about. But I don't like my answer at all. I'm just
And and also to be open to potentially trying topical versus oral. Once you try oral, vaginal, rectal, if neither of those routes work, then topical can also be an option in addition to, playing with dosages a little bit.
okay. I'm gonna cut back to like your answer. Okay.
Okay. And then we do have to
And
wrap up
then I'm
because we're
giving
out
you
of time.
your answer. Just all of that. Sorry, I was having a very fun moment. I think that okay, here we go. Women should not be scared of progesterone. There are going to be some women that are sensitive to progesterone, um, and that could be dose related. It could be the type of progesterone that you're using. It's a small percentage of women that are sensitive. We have to take that into account. We need to find the sweet spot. So if you're too low of a dose, you might be having symptoms. That doesn't mean that at higher doses you will not have those paradoxical symptoms. And you might actually be corrected for the dose that's in your body. So don't be scared of progesterone. There are going to be some women that have rashes, if that's a symptom, or bronchospasm. You need to work with a physician just to make sure that you're not having hypersensitivity. But your hypersensitivity might be a reaction for mast cells degranulating. So histamine might be something that needs to be added, like we talked about earlier, the HIST or the other product that you had named might be something that's worth adding in. But just don't give up. That's
I love it.
that's don't give up. Yeah.
Thank you so much for joining us today, Anat. We'll talk to you soon.
Thank you.
If you loved this episode, follow or subscribe to the Midlife Realignment wherever you listen to podcasts and on YouTube, and leave a review to help other women find this show.